Are you suffering from sciatica right now? Are you dealing with pain in your hip and thigh, even into the back of the knee? Is the pain dull and achy, or is it sharp and radiating all the way down into your foot? My name is Dr. David, and I'm a physical therapist, and I'm the owner of Paso Manual Physical Therapy. We specialize in getting people suffering from sciatica back to being healthy, active, and mobile again without having to rely on pain medications, injections, and avoiding an unnecessary surgery. If you're interested in working with us to resolve your sciatica problem, then I want to invite you to apply for a complimentary discovery visit with one of our specialist therapists. A discovery visit is a 20-minute appointment with a specialist physical therapist where we can put our hands on you and check the problem and give you a diagnosis for this issue. The physical therapists here in my clinic are specialty trained in helping people prevent unnecessary surgeries, get off of pain medications, and avoiding injections while treating the root of the problem to achieve long-term results. If this is something that you're interested in, then click the button nearby here to fill out the form for a discovery visit. If you're looking to learn more about sciatica first, then let me answer for you the 7 most frequently asked questions that we get here in the clinic, as well as on our YouTube channel that has over 100,000 subscribers. The number one question we get is, does sciatica go away on its own? Now, if this is the first or maybe even second time that you've had sciatica, then generally it will resolve on its own. It's just that for some people it takes a few days, and for others it can take a few weeks. If this is your 3rd or 4th time or more dealing with sciatica, then it tends to last longer, and in some cases it becomes chronic where it just doesn't go away. It's just more intense or less intense. The second question is, will walking help sciatica? Walking actually tends to make sciatica worse, especially if the sciatica symptoms are radiating from the back of the hip into the thigh, knee, and even into the foot. Then that's a sign that your sciatic nerve is especially irritated, and any sort of consistent movement is going to make it worse. Now, the same goes for any cardio type activity, because it's consistent movement where you're just doing reps and reps for an extended amount of time, like swimming, like using the elliptical machine, or even bicycling on a stationary bike or an outdoor bike. You're moving your legs consistently in all of these activities like you would be with walking, so it's going to aggravate your nerve more. In the short term, walking's not a good idea. But once the pain is under control, then walking can become helpful for treating a sciatica problem so that it's not coming back over and over again. The third question is, what activities make sciatica worse? Well, besides walking and those cardio type activities, any sort of stretching, massage, or vibration into the nerve area that comes into the butt area, the glutes, down the back of the thigh, and the whole pathway of the nerve, any kinds of those activities is going to make it worse. And let me just unpack those a bit for you. Stretching can actually feel good in the short term, because whenever the sciatic nerve gets irritated in sciatica, the muscles around the nerve will start to stiffen up, and stretching those loose can actually feel relieving. But if your nerve is very flared up and you're putting a stretch through your nerve in your hip and thigh, then it's also going to stretch the nerve, which is actually negative. It's a bad thing, and it keeps the nerve irritated for longer. Massage can be bad for sciatica, because if you put pressure directly on the nerve, as people often do, sometimes they reach under their leg and they're massaging the area that hurts, and they'll find a spot and dig in there and get that "it hurts so good" sensation, but it actually irritates the nerve more. So it has to be done very carefully in a way that only gets to the muscle. And if you're not a trained professional and you can tell the difference between a muscle and nerve, if you're on the nerve massaging it, it's actually going to keep the problem there for longer as well. And now vibration, especially from tools like these types of massage guns that can pound away at an area, that vibration is actually known in research to aggravate nerves even more. They've even tied it to vehicles, like driving in a car, or if you drive for a living, or if you're traveling, like if you're going on a trip, you have to be in a car for a long time, or you have to fly in an airplane for a long time. The subtle vibration from any one of those vehicles, whether it's an airplane or a car or truck on the ground, that vibration over a long period of time can actually feed into irritating a nerve as well. Question number 4 is, what will the hospital do for my sciatica pain? The hospital emergency department often sees people that are extremely flared up from sciatica. I mean, it's so flared up that they cannot get comfortable, and that might be you. You can't find a comfortable position to sit in, to lie in, to fall asleep in. Even standing up straight and walking can be extremely painful and uncomfortable. In those situations, when you go to the emergency room or the emergency department, they'll initially do x-rays, a CT scan, possibly even an MRI, because they want to see that everything's intact, that nothing's broken. They want to make sure that no bones are broken, that nothing's dislocated. And if nothing is broken or dislocated, then what they're going to tell you is there's nothing else we can do except to give you pain medications and muscle relaxers. So they'll usually prescribe you high power muscle relaxers and pain medications that can dull the pain, usually not get rid of it completely, but at least get it down enough for you to get comfortable and sleep and be able to tolerate life for a little bit. But the concerning thing that people run into is they know that these medications are eventually going to wear off, and they can't rely on these medications day in and day out because they're harmful for other body parts, for our organs. So it's not a good long-term solution. But in extreme pain situations, that's what the emergency room is there for. The fifth question I get is, what will the doctor do for my sciatica? Like if I go to my general doctor. In your doctor's office, they'll often prescribe you steroids, like a steroid pack where you take so many pills one day and then a few less the next day and then one or two less the next day. And those types of medications are steroids that are designed to bring down the inflammation and to help the pain. They may also prescribe other types of pain medications that are non-steroidal, but the focus of what they're going to be doing is giving you pain medication. If those pain medications aren't helpful, they might recommend giving you an injection where they inject pain medication as well. They may do x-rays or order an MRI as well to see what's going on in the spine, because there may be pinched nerves from disc herniations. And they'll look at possibly referring you over to a surgeon, and at the very least, they'll definitely recommend physical therapy for you. Now, question number 6 is a continuation of that. People always ask, do I need to have surgery if I have sciatica? So if you end up going to the surgeon's office, it's rare that they end up doing surgery right away for somebody dealing with sciatica, because sciatica is a problem in multiple body parts. It can be coming from the back, but also from the hip, from the thigh, from the knee, from everywhere that the sciatic nerve runs to, all the way into the foot. If a surgeon is going to go in to operate on something, they're usually going in on one spot, maybe two at most. And if they can't pinpoint with certainty that it's coming from, say, a disc in your back, they're not going to tell you that you need surgery. What they're going to do first is offer you pain medications like your general doctor might, and injections as well, and they'll probably send you to physical therapy. Now, question number 7 is, what is the best way to relieve sciatica? Now, doing the right exercises at the right time, combined with the right hands-on treatment to get the bones adjusted, to get the joints freed up, the muscles loosened up, that is what cures sciatica for the long term. The right exercises at the right time helps to address the muscle imbalance that ends up creating the stiffness in the joints and the muscles. So treating that muscle imbalance is the root problem of sciatica. Now, I recommend you get help from a specialty trained physical therapist, because they're going to know how to identify and treat a muscle imbalance. Whereas I caution you in going to just any physical therapist, a general physical therapy clinic, because general physical therapy clinics are best at treating people right after surgery, not before they end up having surgery, as you probably are. If you have sciatica right now, then you haven't had surgery recently, so it doesn't make sense to go see a physical therapist who's seeing people that have just had surgery all day, because that's what they're going to be best at seeing. The physical therapists here in my clinic are specialty trained in helping people prevent unnecessary surgeries, get off of pain medications, and avoiding injections, while treating the root of the problem to achieve long-term results. You can see if it's right for you to work with us by taking advantage of applying for our complimentary discovery visits. Once you hit that button and go submit your information, our staff will receive that and they'll give you a phone call as quick as possible in order to begin taking you through the application process over the phone. I sincerely hope that you can get better as fast as possible, and that we can help you get to that point where you're back to doing all the things that you love to do.